Good afternoon, Dr. Kasirye and Siobhan.
Yeah, good afternoon. Thank you for having us. We're going to give the COVID update right now. I just wanted to start out with a few announcements, and then I'll turn it over to Dr. Kasirye for a more in-depth review. So I wanted to mention that the FDA this week approved the use of the Pfizer vaccine for individuals who are 16 and older. It is still under emergency use authorization for individuals who are 12 to 16. So that's good news for all of us. I also just wanted to mention that the state has issued several state health officer orders over the last several weeks, mostly having to do with different employees in different sectors who are now being asked to take the vaccination or verify through testing that they have negative tests. So there's a lot that we're tracking and watching with regards to that. It doesn't affect some of our county employees who work in either healthcare settings or congregate settings, and we are working to set up additional testing capacity to be able to ensure that they have access to testing. I also wanted to mention that this morning there was some discussion about the Sierra Health Foundation, who will be coming back on September 14th to do a more in-depth presentation. One of the things that you have in your COVID report, the PDF that's a 2-pager, on the second page we routinely report some of the outcomes that Sierra Health Foundation has as a result of the funding that we provide. The flexibility in that contract really does allow us to be responsive as the needs of the pandemic have changed over time, and so that's part of the reason why we have so many elements within the context of that contract. I also wanted to mention that Sierra Health Foundation does keep a dashboard that will allow you to go at any given time on their website and look at the additional outcomes that they're achieving with these dollars. And then finally, before I turn it over, I just wanted to mention that, as the rates have climbed and we've seen them steadily climb, we still are really hoping to partner with the community and organizations and the board to ensure that we're getting as much information as we can out there about vaccinations, because vaccinations are still a really important tool for us to be able to end the pandemic. So I will turn it over to Dr. Kasirye.
Good afternoon, Supervisors and Madam Chair. So I do have something on the overhead and then a PowerPoint. So maybe I'll start with the overhead so that I can then transition to the PowerPoint. Can I get the overhead, please? Okay, thank you. So a lot of the questions, as you can imagine, that we're getting are about the cases and the vaccinated versus those that are not vaccinated. And so this is a slide from a presentation that was given to us by the state, and it does show some information, and I just wanted to go over it and then go into our PowerPoint. So on the left-hand side, you see incidence rates versus vaccination status. So you see for the vaccinated versus the non-vaccinated. I think there's a number that's missing from there, because for the non-vaccinated, it's 200 per 100,000. When you look at hospitalizations, again, you can see the difference with 3 per 100,000 for those that are vaccinated. And then for the deaths, it's 1 per 100,000. Then on your right-hand side, you can see the increase in frequency among unvaccinated. And so for infections, those that are not vaccinated have an 8 times higher risk of infection. For hospitalizations, 25 times a higher risk. And for death, it's 24 times higher risk. And this is from the CDC. And then can I go back to the PowerPoint, please? Thank you. So just wanted to point out that on our dashboard, again, because we're getting a lot of questions about vaccinated versus not vaccinated, we have added additional information under the vaccination tab. One of them is a chart that you see over here that shows the 7-day average case rate by vaccination status. So this is the case rate, and if you look, the top line is for the unvaccinated, and the case rate is at about 45 per 100,000. The bottom line, the blue, is for those that are fully vaccinated, and that is at about 5 to 10 per 100,000. This is for Sacramento County data, but if you were to look at the state, the graph shows exactly the same kind of difference. I was also asked to answer some questions. I'll go over those. One of those was about the number of reported breakthrough cases. A breakthrough case, again, to remind you, is of cases of those that are have COVID-19, have symptoms, and are also at least 2 weeks beyond their completing their vaccination. So that would mean that if it was J&J, it's 1 dose, and then if it's for either Pfizer or Moderna, that would be 2 doses, so 2 weeks beyond their second dose. And this information is on our website as well, on our dashboard, and it shows that for the latest numbers that we have, a total of 3,852 cases of COVID-19 among those that are vaccinated, and that's like the total, and then 1,020 with symptoms. So if you look at the state definition of a breakthrough case, it's the 1,020. Whereas in total, for those that have symptoms and those that do not, is 3,852. This is compared to a total of 122,791 for all cases of COVID-19. When you look at, actually, this last question can be answered by my next slide.
Dr. Kasirye.
Sorry.
I know if Supervisor Cerna has a question, but I wanted to just quickly ask, where is the data from where does this data come from? The hospitals, or who's reporting these numbers?
The reports come from everywhere. They come from healthcare providers as well as the hospitals.
Okay, thank you.
Because every healthcare provider is required by law to report certain infectious diseases, and COVID-19 is one of those.
They're required by law?
Yes.
Okay, thank you. Supervisor Cerna.
Thank you. So before you leave this slide, I just want to make sure I understand it. To me, it seems like it's telling the story that fully vaccinated folks in Sacramento County, is this Sacramento County, by the way?
This is Sacramento County, yes.
So folks in Sacramento County that are fully vaccinated are 4.5 times less likely to be identified as an active case than someone that is not fully vaccinated.
You could put it that way, yes.
Okay, thank you.
So before I leave the topic of vaccination, this is a slide that we got from UC Davis. I know that you all have been interested in the hospitalization, and we have pointed out to you that the vaccination status on the hospitalized cases takes us a bit longer to get, because we would either have to request the hospital records, or we would have to match the information that we have from the reports with the information from the vaccine record database. But of course, the hospitals do have the information, so UC Davis provided this to us. And again, it shows you in comparison, and this of course changes on a day-to-day basis. So this was for August 18th, and it shows for 67 hospitalized cases, 59 were unvaccinated, 4 were vaccinated but had immune-compromised systems, and 4 were vaccinated and were not immune-compromised. When you look at the intensive care unit, 21 in the intensive care unit, 18 unvaccinated, 2 with immune-compromised systems, and 1 vaccinated with no immune-compromised system. And then those on the ventilator, 13 total, 11 unvaccinated, 1 vaccinated, immune compromised, and 1 vaccinated, not immune compromised. And then ECMO, that's the system that they use where someone, they basically have to, they have a system that breathes and circulates the blood for a person. There are 2, and both of those are not vaccinated. So that's I think that completes the questions that I had on vaccination status. I want to go back to this slide, which is another question that we've been asked a lot about, which is how are we doing with congregate facilities? Because as you recall, when we've told you during previous surges that we were experiencing very large outbreaks in the congregate facilities or long-term care facilities, which include the skilled nursing facilities. And so if you look at the beginning in January, you can see the number of cases we were getting. The brown line shows the general trend or the numbers overall for that surge. Then you see the numbers go down as we went to February, April, and May. And then you see what's happening now with the current surge, where you see with the brown line that we seem to have plateaued. But what's also significant to point out is that even though we are beginning to see outbreaks in the long-term care facilities, they tend to be small, usually 5 people or less, and usually it's unvaccinated employees. But we do have some cases of residents that do get COVID. But when you compare this surge with the surge before, I think that's one question that I was asked is when you look at total cases, we're maybe at about 50% of the peak that we had in the winter surge, whereas when you look at hospitalizations, it's like at 85% of the peak. So I think that a lot of the difference is because we are not seeing the large outbreaks in the long-term care facilities. So I think it's a testament to the effectiveness of the vaccines, because very early on during the vaccination rollout, the pharmacies went out and did vaccinations, and now when you check, about 80 to 90 or sometimes 100%, especially of the residents in these facilities, are vaccinated. So it has really helped to control the outbreaks in those facilities. And that last question I was asked is about what is happening with booster shots. Since I believe that's one of the points that Ms. Kasirye pointed out, is that both the CDC and FDA and CDPH have approved booster doses or third shots for people that have compromised immune systems. We in Sacramento County are continuing to focus on first and second doses because we still have areas in the county where the vaccination rates are 40% or maybe at least less than 50%. So we're still focusing our efforts there with our pop-up clinics. But we have been communicating with our health system partners, and many of them are able to provide these shots, booster doses, for the populations that are approved for now, the immune compromised, and many of them have told us what system they have in place. Of course, we're monitoring also the demand that we're getting, because we are very aware that there are some people who may not have access to a healthcare provider and might need our support. So we're monitoring that, and with some of our partners, if we do see a need, we can very quickly ramp up and set up some specific clinics for people that are needing a booster dose. But right now, it seems like the health systems are able to handle it, so we continue to work with them on that. So I'm going to switch gears to give you an update on where we're at with vaccinations, vaccination equity, and this is something we've been working with the state on. So they have been providing us with these slides. So our health equity quartile, we're at 61%. So if you recall, when we started off, we were like 20-30%. So we've made a lot of progress. We still have a ways to go, but still to see that it's at 61% is great. And then we still have work, especially with our communities of color at 42% for the Latino communities, and then 46% for the Black. And so again, we continue to work and want to thank all of our community partners and that we're working with. Many of them are part of the SAC Collab, which is the process that is being coordinated by Sierra Health Foundation, because they're the ones who help to set up these clinics, do the outreach in the community. And I know it's a bit hard to read this on the overhead, but you do have the PowerPoint, so you can look at it. So this just shows you the vaccinations in the blue by zip code, and we still have some that are in the 40s, so those are the areas that we're focusing on. But glad to see that we actually now have some, like at the bottom in Cortland, that are at 100%, and others at 90%, so a lot of progress overall for Sacramento County. And you can see that the higher quartiles, I believe all of them are over 50%, so slowly making progress. And overall, I think it is in your the update, the summary, that we are at about 61% for Sacramento County. I wanted to provide this to you, and I did get permission from Dignity Health. Dignity is one of our partners. They've been working with us, especially in doing outreach to the schools when we were having a lot of the school clinics. So they provided us this summary of some of their efforts, so I just wanted to quickly go over it. This is where we started off, and the lines that you see are actually the statewide, and at the bottom you see what the different colors stand for. So the one that we're most interested in is the number one, which is a health equity quartile. And you can see that when our vaccination efforts started out, because we were focusing more on certain occupations, there was a huge disparity, and most of the vaccine doses were going to quartile 4, and quartile 1 was way behind. And so we worked really hard to work on that, and this is not just for Sacramento County, it's like the state in general. And by the end, we've been able to narrow and eliminate the disparity that we were seeing. So I won't spend a lot of time on this. This is just some of the sites that Dignity Health was focusing on, and it shows you a breakdown of the population in the clinics that they were having. And this shows you some of the impact that they had, and it shows you that the value of the targeted outreach, and also the value of working with a school. Quartile 1, most of the people that they were vaccinating were from quartile 1. It also shows you the clinics by showing you the occupation, race, ethnicity, and again, just showing you that these were the areas where they were targeting and they were able to reach their target. And then this shows you by race, ethnicity for the different clinics at the bottom. It shows you that each large bar stands for one of the clinics, and you can see the breakdown of the race ethnicity for each of those clinics. And then this is by age, and it does show you again that when the vaccine was made available for teenagers, that they did show up, especially for the clinics that were affiliated with the schools. So, and this is the last slide that just shows you that in comparison to overall state, that their outreach, they were very successful in being able to provide vaccinations to individuals in quartile 1. I think that concludes the information that we had for you.
Supervisor Desmond.
Thank you, Madam Chair. On the last slide, this is SAC Unified, do you know, is Dignity Health doing any of these kinds of partnerships with either Twin Rivers Unified or San Juan Unified?
So the way that we did it, because we were working with each of the 4 health systems, is that they kind of divvied up the different school districts. So Dignity did work with Sac City Unified. I can't remember which one worked with Twin Rivers. I can get that information for you, but we kind of divvied up all of the school districts. So I can go back and get that information and send it to you.
Oh, that'd be great. I appreciate it. So they'd be able to provide some of this information for those other districts as well and some of their work?
Yes, we're still working to be able to provide this kind of information for all of the clinics that we were doing, but it's going to take us a little while. But since I was given this presentation, I thought that this was probably information that you would be happy to see.
Okay, thank you, Dr. K.
Thank you, Supervisor Desmond. I do not have anyone at this time in the queue, so I think I'll go to public comment.
Sure. Thank
you. Were you done with your presentation?
Yes, thank you.
Thank you.
I'm sorry, Madam Chair. I actually did just a couple things before we start on public comment, and I imagine we probably have a lot of public comment. Just wanted to mention, Dr. K, you came out to a clinic we hosted in North Highlands a week ago Sunday, and I just really appreciate that so much. You came out and stayed the entire time, and you and I talked for a while, and I've been like a broken record with Bruce and our county exec without a qualifier in front of her title anymore. I look at and I want to do more of those clinics, obviously in partnership with public health and in partnership, obviously, with Sierra Health and their partners. And I just want to take a quick comment on the list of all the vaccination clinics, which I think is great and it's terrific. It just strikes me that out of, I think, 106 clinics listed, only 10 of them are in District 3. There were some that were erroneously attributed to District 3. And I know there's a lot of factors that go into where you put these clinics, but obviously at that clinic in North Highlands at a park, and we've got, I think, 69 folks vaccinated, which is just awesome. Yes. That, to me, really shows that there's a lot more opportunities up in that part of my district. So just, again, want to reemphasize how much and how eager I am to do more of this up in District 3. So.
Yes, and we definitely appreciate the partnership with you. And actually, we've been discussing that with our stakeholder group as well, because when you look at the zip codes, again, the northern part of Sacramento seems to still lagging behind, even though we've made quite a bit of progress. So we are planning to have some really concentrated efforts, just like what we did for South Sacramento and the Pannell Center, and have more of our community-based agencies have actually concentrated efforts there. I'm hoping that I'll be able to come back with our plan very soon. They're still working on it, but we definitely want to be able to have more of those in the northern part of our county.
Thank you, Dr. K. And I will be a champion for those efforts and assist you any way I can. Thank you.
Yes, thank you.
Thank you, Supervisor Desmond. Supervisor Cerna.
Thank you. Wanted to ask what our process going forward is going to be, if at all different than what we've experienced in the past when it comes to the use and utilization of our mobile vaccination units, especially as it relates to kind of the trend we're seeing with large employers, including City of Sacramento, and regardless of where people might be on vaccine mandates. Are we actively looking to partner when large employers do present to their employees these mandates, so that if you had employees that were on the fence, they're not vaccinated, now they're going to be required to be vaccinated to report for work, how are we taking advantage of that with almost every day there being another large employer, whether it be Walmart or local municipalities that actually require vaccines to report for work?
So we have been presenting to the businesses on a regular basis and looking for opportunities to partner with them, and we've actually received a lot of requests, and so our team has been working on that. And we had kind of petered off the weekly calls because we thought things were quietening down, but now we're going to start being able to meet with them on a weekly basis again, and use that opportunity not just to give them an update about what we're seeing, but also as an update to, again, put the call out for them to be able to contact us if they have the opportunity to work with us for these vaccination clinics.
If I could be so bold as to suggest that, and this kind of speaks to Supervisor Desmond's statement about, rightfully wanting to be very involved in the continuation of community vaccination in his district. I think it would be worthwhile to think about how we get to a place where if an employer is identified in a certain part of the county, in a certain supervisorial district, not only would you coordinate and offer the services to that employer, but work with the supervisor's office where, those, whether, let's say it's just by way of example, a Walmart distribution center that is going to have a policy in place that requires employees to be vaccinated. I certainly would love to be helpful in that capacity to help get the word out. Certainly do it with multiple languages. And I think there's a lot of developing opportunity. Again, regardless of where you are in the politics of mandates, if they're happening, let's take full advantage of them.
Sure, and I appreciate that, and I know that the team is listening, so we will definitely do that. I know that they have been reaching out to your chiefs of staff to provide information, but definitely will be more active in seeking your presence at some of these events as the opportunities present.
Great, thank you.
Supervisor Natoli.
Yes, thank you, Madam Chair. Thanks, Dr. Kasirye and Dr. Kasirye. Just a question. I know we just in the last couple of days with the furtherance of the discussion regarding a booster, a third shot, and obviously the focus here has been on folks getting their initial vaccinations. How do we plan, or I guess we're still putting together plans to either complement what we're doing or rolling this out? Because as you list dates and places and so forth, for those that would seek to get the booster, because again we're now getting to a point in time where those that may have received them January, February timeframe, if whatever the period of time is between the initial vaccination and booster shot, if that's what people choose to do. I guess I'm curious, where are we with that? What sort of mobilization will go with that? Obviously, administering shots and vaccines will, going to be for at least the immediate foreseeable future. In addition to continuing to, move in the fronts that you've outlined here today. So I guess I'm curious about where we are with that, and I just think about the fatigue, I think the ongoing efforts of all the staff and partners who are out there, the drive-through. We're still doing testing. We're still doing obviously administering vaccines for those that are choosing to get them, and so I'm just curious about how that gets folded in, because we're just at the beginning stages of that. So if you could share a little bit on that.
Yes, and right now, as Ms. Kasirye pointed out, the approval is only for those that are immune compromised, and so a lot of them are going to their healthcare provider. And as I mentioned, also we are monitoring the requests that we are getting. If we see that the resources that we have right now are not enough to meet the demand, then we do still have our partners who helped us at the beginning to ramp up. And they said they're willing to ramp up again. They're on standby. And as I mentioned, we can quickly set up clinics where we just are able to provide those booster shots, especially as we get to mid-September, when we anticipate that they might make the approval for everybody else who would like to get a third dose. So we're monitoring it. The other thing also is that we're still working with the state because with the vaccine rollout, the long-term care facilities were handled by a contract between the CDC and the pharmacies, and that really helped to spare our resources to be able to do the community clinics. So we're hoping that that will be reconsidered. I don't have a final word on that yet. I guess the state is still discussing that to see if it's a possibility, because if they're able to do that, this is one of the most vulnerable population, and we have seen how effective the vaccine has been in preventing large outbreaks. So definitely our hope is that we'll be, and of course they were among the first to get vaccinated, so they're probably at that point where they might be experiencing some waning of their protection. So I'm hoping that I'll soon have some word on that, but we have some tentative plans in case that does not happen.
So,
and that's through our partnerships.
Yeah, no, thank you for that. So is the booster, is it a distinct dosage? Is it a different segregated, type of, whatever the vaccine is contained there, or is it? So is it going to require special handling, and is it approved for all three of the current? I guess the two that are still waiting final, but obviously the Pfizer received the FDA approval. But with Moderna and Johnson, or the Janssen, Johnson.
Right now, the approval for the booster or third dose is only for the 2 mRNA vaccines, so that's Moderna and Pfizer. And it's actually exactly the same as the other doses.
Oh, it is?
There's
Okay.
nothing that has changed. It's just that in the studies, both from Israel and also some of the studies that they've been looking at the national level, there's been a little bit of waning in the protection, especially for people that are immune compromised, but also for others, especially beyond the 8 months. And so the expectation is that by giving this shot, basically what it does is like a reminder to the body and the immune system of what the enemy looks like and what they need to look out for, and be able to again raise the number of antibodies and cells that are able to provide that protection.
So you mentioned the work through the CDC and I guess the pharmacies for some of the long-term care facilities, but if I remember correctly, we had cooperation from the fire departments with our mobile team and deployment of that going back many months ago. And they were strong partners, and I think in going to maybe not the long-term care, but going to facilities where you had any number of folks, but that weren't necessarily able to all come certainly in large groups to say Cal Expo. So are they still being deployed? Are they still available? Is it being contemplated as part of your planning looking forward, Dr. Katie?
So the fire departments have been fantastic partners for us, especially with helping with the long-term care facilities, especially with the testing. But now that we're in the summer season with all the fires going on, we know that we can't depend on them too much. We do have some of the private ambulances that we still have a contract with that are still helping us, like with the homeless. So I hesitate to put that out as an option right now. Maybe if things quieten down with the fires, I'm sure that they would be willing to help us, because they've told us that whatever we need, they're willing to help us.
Right. No, and I appreciate where we currently are in our environment here in California, and certainly the firefighters are on the front lines, all around us. Okay, so will you, in subsequent reports, kind of keep us posted then on the approach as, I guess, things unfold? You do all the time, but particularly with the booster, because again, that's just becomes additive though to, and again, if there's some determination made that beyond those that are compromised, that there's a more broad application of that, and that just it puts another layer on what you folks are given charge to do, and that is try to get the vaccine to as many people as we can and make sure that it's effective as we can be.
Sure, it's definitely added an additional layer of work, but we know the vaccine works, and we have a lot of people who have come alongside us who've been helping, and so I believe that we'll be able to meet the challenge when it comes.
Thank you, Dr.
Thank you.
Dr. Kasirye, are you following the people after they're vaccinated? Like, do you follow them to check in on them like in a normal trial? There's a control group and you're watching people to see their reaction to whatever the medicine you're in a trial.
The trials were done by the companies, so we're not doing the trials right now. We do, following the guidance that we have, where after a person gets a shot, they are observed for a minimum of 15 minutes. And if they have a history of an adverse reaction, we actually increase that to 30 minutes. We also give them information about what to look out for, and they can
what to do if they have an adverse reaction.
Yes, and we also give them information. They can enter their information into a database that will check on them, but that's a voluntary thing where they can have a system that checks on them and asks if they have any side effects or not.
So you're saying this is not a trial?
It's not.
This is, you're saying this is this is not a trial?
The Pfizer vaccine is fully approved, and the trials were done last year. So
it's approved under an emergency authorization, but
no,
because there's no treatment. But
it's been fully approved.
The FDA approved yesterday the Pfizer vaccine.
They extended the emergency authorization.
No.
They approved.
It's full approval.
Okay. Well, I'm not going to. We'll move on to Supervisor Kennedy.
Okay, thank you very much, Chair. I was very, very pleased to see it get full approval from the FDA, as they say, the gold standard for those age groups. So no longer a trial, fully approved. A couple of things. First of all, Dr. Kasirye, I'm not about to tell you how to do your job. As a matter of fact, I'd rather you tell me how to do mine. I've watched the efforts, and along with, by the way, the firefighters, the National Guard has been phenomenal in areas that they've gone in District 2. I mean, just great. Now, there's appropriate places to send the National Guard, and there's those areas that probably not so much, but you've handled that also with a great deft touch, so I appreciate that. But I hope that you all are, and again, not to add to your job, but I just feel like I have to say it, reaching out to your counterparts throughout the state to see, what is working, what isn't working, because I think that we have done a good job with the lower hanging fruit, and we've kind of, now hopefully the new approval, I've heard somewhere around 30% or so of Americans were hesitant because it hadn't been fully approved. Now it has. Hopefully we'll bump that, get those 30% in. So we started with the big events. We kind of exhausted that audience. Then now we're doing more of the pop-ups, and I mean, as an example, at Siemens, I asked you to, have, I believe it was Olivia, go out there, the truck, and, because we didn't know who had been vaccinated and who hadn't, because obviously privacy concerns. But I had said to you, I said, I'm going to feel terrible if only 5 or 6 people show up. And you said that's 5 or 6 we don't have. So that's a good message to tell people. We ended up getting dozens, by the way, out there. It was a huge success. I just saw, on Saturday at the Golf Course Terrace Neighborhood Association, there was a truck out there, and they had, I think, 5 plus testing. But 5 vaccines. So, we're hitting those in, small increments. But I mean, I don't know. I mean, I've heard going door to door doesn't necessarily work. I mean, for that next layer of strategy, I'd be very interested in see what y'all come up with, because the big events are gone, but we need to go to where the people are. And so that's just me spouting what I'd like to see. So thank you so much for your work.
Thank you. And there are different reasons for why people are hesitant, and that's why we're trying to work on it in different ways by having the community-based agencies do the door-to-door, which is successful, but sometimes you end up with just 5 people. But
right.
That's 5 more people that are vaccinated. The other is using the vaccine influencers, which are lay people that have the correct information about the vaccine and are able to talk within their community and provide that accurate information. And then for some people, it just takes time, because we've been in places where they said, well, I'm going to wait until my friends take it and make sure that they're okay. And so it's a matter of going back again and again and again. I've talked to some people who've been talking to their relatives, and one person said, well, every time I talk to my sister, I asked her, have you made the appointment? Have you made the appointment? And then finally she did. Same with the doctor's office, because every time a person goes to a doctor's office, that's an opportunity to ask about the vaccine. And it has worked, where after a while people will say, I don't really have a reason for saying no, so I'll just do it. In fact, even when we were at the park, there were some people who walked up and said, I'm still kind of hesitant, and we're like, you're going to be okay. And just having people around who are supporting them was enough to get them over that last.
Well, it's clearly not a one-size-fits-all approach. I mean, there's cultural sensitivities, there's educational sensitivities, and there's you remember the woman at the first pop-up we did with the new vans or the new trailers at Valley High Library. She is hesitant because she was afraid of needles. So I mean, there's so many different reasons. That's why we have to approach this in so many different ways.
Correct. Yes.
Thank you.
Thank you.
Thank you, Supervisor Kennedy. Supervisor Cerna.
Yeah, and just to dovetail a little bit off of that, this goes back to my earlier comment about, how are we planning to exploit in a good way the fact that we have so many growing numbers of employers that are requiring the vaccine, and then how do we, become a very active and valued asset to accomplish that. It seems to me that with the news that especially with the Pfizer vaccine, that it's a fully fledged, non-trial, fully developed and tested, accepted vaccine. It seems like, given the fact that that was just yesterday, that there's probably a group of those that were previously hesitant just based on that fact alone, that we should be going out immediately this week. And I don't know if there's any change that is that fast in terms of our protocols, but it seems to me like that's a case in point where the environment has changed, the public debate has changed a bit, and we should be totally taking advantage of that to go reach those people that, for them, that was kind of the seminal issue. So that, I just want to make that comment. And then, this question, I don't know that this question has been expressly asked of you, Dr. Kasirye. Perhaps it was in a roundabout way during our June recommended budget discussions, but because it's been about almost exactly a year since you stood in front of us when I had rotated in his chair, and I felt very compelled at the time, for a variety of reasons, to just be blunt and ask you, do you have everything you need? And if you don't have everything you need, what do you need? And you gave us all a memo that outlined and accounted for by activity, and you put a dollar amount to it, something that was pretty clear and understandable by everyone, including the public, that outlined what it was you needed in a certain amount of time to respond to the pandemic. Is there going to be something that we can expect either before or at our final budget discussion that is very similar to that? So this board has a clear understanding that between mid-September of this year and 2024, when the ARPA funding has to be used, that you can kind of give us a roadmap of what your department needs to continue to respond effectively to the pandemic?
And I want to take the opportunity to thank the board again for appropriating those funds, because they helped us a lot in being able to get additional staff and also in being able to set up the contract through Sierra Health Foundation with the 30 community-based agencies to be able to do the work with the testing, with the rollout, with actually even providing wraparound services to members of the community that were hurting. So my hope is that when Sierra Health Foundation gives their presentation, that it won't just be the numbers, that you'll actually be able to hear from the people as well, and how much that those resources helped. And I'm very appreciative of the CEO, and congratulations, Anne, for, we've had very good open communication about the needs with the CEO's office, with the director, in terms of what needed to be done, what actions needed to be taken, and even with the new ARPA funding that's coming to the county, we were able to submit our request. I don't know where it's going to end up, but we did submit the request of what we felt that we needed, and we've fortunately also been able to get additional assistance from the state since additional funding. That these are some of the board letters that have been coming to you for approval. Also, the $10.5 million that was left over from the last fiscal year has been, we've been allowed to continue using that, and again, that's helping us with our efforts, especially with the community efforts, because that's really, really important. We are dependent on the community-based agencies to help us with the outreach that needs to be done.
Thank you for
And I'll
that.
just add one more thing to what Dr. Kasirye is saying, is we are certainly looking at all the opportunities for state funding, and similar to a comment I made earlier about the behavioral health funding, we will ask for ARPA funding to fill in those gaps, but looking to leverage everything we can from the state first. So
Thank you. One last question, comment. Earlier today, we had a bit of a discussion about the needs that are going to present themselves in short order here in terms of an emerging refugee population that we can expect, measured in the thousands. What are we doing today to plan so that when they do arrive, we can offer them the same pandemic response servicing, including vaccination access, that we offer everyone else?
yeah, I'll start, and then Dr. Kasirye can jump in. So under our primary health division, that's where we're ensuring that we are going to connect with every refugee who comes over. We're going to do a health assessment, and during the course of that assessment, they'll be offered the vaccine. And Dr. Kasirye's team has been connecting with our team in the primary health clinic to ensure that that coordination happens.
Great.
Great. Thank you.
Thank you.
Okay, I think at this time we're going to go to public comment, and I'm going to start with those that are in chambers. Let's start with Nicholas White, followed by Sella, followed by Grace Kajimura.